So, what are the early warning signs and symptoms that families most likely miss when it comes to heart failure management at home?
So I think most people with heart failure and their families, once heart failure gets to a certain point, they can recognize it pretty easily. So the things that usually bring people into the emergency room is a very large weight gain, swelling or edema in the lower extremities. You see that a lot, and shortness of breath. So those are the three things I would say that people know are signs of heart failure and that they need to get help. Some of the things that I feel like go unnoticed until they're really, really bad. So think about a patient that typically, if you can lay flat at night to sleep and all of a sudden you need an extra pillow, that might be heart failure. You may be getting some extra fluid in your chest that's causing it to be harder to breathe at night. Another thing that patients often will mistake for various things, if your pants feel a little tighter, like around your waist, sometimes that's a very subtle sign of fluid gain as well. So I think the biggest thing is weights, daily weights, monitor how much fluid you have on board, and thinking about how short a breath you get with usual activities that you wouldn't have a problem.
Thank you. It's incredibly helpful for our listeners. And honestly, recognizing them can be a game changer. So, what does heart failure management at home actually look like, beyond the textbooks?
So, in nursing school, they teach us, all of these, 3,000 symptoms that could be heart failure. It could be something else too, though. But I think for patients and their families at home, things like weighing yourself every day. If you gain more than 3 pounds in a day or 5 pounds in a week, unless you're on a cruise or your wife made you Thanksgiving dinner, it's probably fluid. So a rapid weight gain like that is definitely cause for concern. So those things alone, I would definitely reach out to your heart failure coordinator or your cardiology office. Let them know. A lot of times, if we catch these things early, we can even do things like give you IV medications in the office to keep you out of the hospital. So being able to pinpoint um, signs and symptoms very early, even if you're starting to have an exacerbation, we can still keep you out of the hospital. So we talked about, the daily weights at home. Other things such as recognizing the salt content in foods that you eat. So salt attracts water. And if you have a lot of sodium in your diet, it's going to make you retain more fluid. Even patients like my dad, for instance, he doesn't have heart failure, but if he eats a hot dog and french fries, his wedding ring may not fit because he's going to swell a little bit. Well, if your heart's not working properly, it's that times 20. So really being aware of the sodium content in your food, especially canned foods or processed foods that you get at the grocery store, those typically contain a much higher sodium content. So don't be afraid to look at those labels, when you're buying things at the store.
So, it is a combination of daily food that you eat and also
Mhm.
tracking the symptoms that mentioned by the doctor. From your experience, what has separated patients who do well at home from those who end up back in the hospital?
Please encourage patients to be very curious, ask questions, be involved in your care. The more that you understand why you take your medicines or why we're asking you to do what we're asking you to do, all of those things kind of start to click and you're connecting the dots about how heart failure works, what I can do, what I can't do. So I really encourage patients to, do everything you can to understand the disease process and to understand the treatment plan that we have. With heart failure, there are guidelines that we try to get every patient on, but it very much can be individually tailored to the patient, how much medicine you can tolerate, how far along your heart function is. So it can be very difficult, I guess, to get a patient on exactly what we need them on if they're not interacting with us, if they can't tell us they're tracking their weight, or if they can't tell us they're limiting sodium or fluids and things. So I just really encourage you be involved, ask questions, and try your best to do what your doctor tells you to do. And those are the things that will really help keep you out of the hospital. And having a really strong family support, even if it's friends. It doesn't have to be your blood relatives. It could be the family you create for yourself, but having them involved so that you feel supported, that's huge too.